What up, people?
Tell them what we about to do, Adelaide.
Okay, so we are going through all the Tennessee mock skills. So we are going through all of them. So that would be helpful for people who are taking their state exam tomorrow. Okay, so right now we're gonna start with nail care to one hand.
Right.
So move over here. So he's gonna follow me.
Here I am.
Right.
Hey, everybody. Hi, my name is Sharonda. I am the owner and the instructor for the Allegiant Institute of Healthcare Solutions. Tomorrow, we will host the CNA State Exam. Some of my students are at work, so I am going live now, going through the CNA skills in order to make sure that the students that are not able to be here to do their final practice run, they're going to get their final practice run tonight because I'm going to do the skills for them. So you guys, hopefully you are tuning in to us tonight while we go through all of the skills. There are 20 CNA Skills Scenarios that you need to be familiar with on tomorrow. Tomorrow you will be given by the RN Test Observer 3 or 4 skills. Now, we know that you will get at least one of 4 skills that's going to be bedpan and output, perineal care, catheter care, or emptying a drainage bag while wearing PPE. If you are a testing candidate for the state of Tennessee, you will be issued one of those 4 CNA scenarios. In those 4 CNA scenarios, remember, you have to step away to the sink and do hand washing at the end of those skills. We're going to go over just a few quick things before we get started. There are 7 skills that you need to wear gloves with. That's denture care. You will need to wear gloves. Mouth care, brushing teeth. Mouth care of a comatose resident. You will need to wear gloves on bedpan and output. You will need to wear gloves on catheter care, denture care, perineal care, and emptying a drainage bag while wearing PPE. There are 7 skills that require that you don gloves in order to demonstrate that skill. And then the other 13 skills don't require that you wear gloves. You will need to position the head of the bed flat when you are demonstrating range of motion of the hip and knee, when you are demonstrating range of motion of the shoulder, when you are demonstrating position a resident on their side, and last but not least, when you are making an occupied bed. Now, when making an occupied bed, the actual skill steps does not require that you put the head of the bed flat. However, to improve your workflow, it's important that you position the head of the bed flat so that you can apply the sheets without difficulty. Okay? You got that? All right. So we're going to start off our first skill. What are we going to do first, Adelaide?
We're gonna start off with nail care.
All right, so our first skill that we're going to start off with is nail care. All right, so what's important about the skill nail care? It's important that you remember to soak the resident's hands. You have to verbalize out loud that you are soaking the resident's hands for 5 minutes. The RN test observer does not expect for you to stand there for 5 minutes and soak the mannequin's hands. However, you need to voice that you have soaked the hands for 5 minutes. Anytime we're going to be dealing with water, we're going to allow the resident to test the water, or we're going to verbalize that the water does not exceed 105 degrees. That is a test question. You need to know the average temperature of bath water, okay? So because I will be soaking her hands, I want to make sure that I know that that water the temperature of that water is not to exceed 105 degrees. So those are the pertinent things that you need to remember to be successful when demonstrating nail care. All right, you do need some supplies for nail care. You will need a emery board or a nail file, and you will need a orange stick. You will also need one hand towel when demonstrating the skilled nail care. All right, so let's get started. Always knock on the door, introduce yourself. You're going to wash your hands at the beginning of each skill, and you're going to wash your hands at the end of each skill. This particular skill does not require privacy. However, do not freak yourself out about which skill requires privacy and which skill does not require privacy, because you can pull the privacy curtain on every single skill. I will tell you as we're going along what skills require privacy and what skills do not require privacy, okay? However, on the day of the state exam, to decrease any anxiety that you may have, if you're unsure or super nervous, go ahead on and pull your privacy curtain. You will never have points taken away for giving the patient's privacy. All right? All right, you guys, let's go.